That is a full dilatation of the cervix. That is called full dilatation of the cervix. It is 10 centimeter. Okay. You see then that is full of the labor by the partograph. By placement of the partograph, we should see the maternal condition, pulse, blood pressure like these others, and we should see the fetal heart sound, fetal descent, moulding. Sometimes there is changes in the fetal head moulding. And then what we need to check the cervix dilatation and other findings like membrane rupture or not. If membrane rupture and color is good, that is normal clear color, that is okay. Membrane, if meconium stain, then there is grade 1, 2, 3 meconium stain. Grade 1 we accept, grade 2, 3 that means fetal distress. How can we follow up another way? Fetal monitoring. There is by auscultation, normal stethoscope, another is Doppler machine, another is cardiotachograph. I told you last class, CTG, cardio কি? Cardio, এই তুমি ফলো করতেছো না ক্লাস? Cardiotachograph. বুঝতে পারছো? আচ্ছা, now we go to the next, that is very important, the stages of labor. That is very, very important. Everyone should know about these stages of labor. Stages of labor. I think already you know in the word who are doing in the gynae also. I think all should finish the word placement. No one? Why it is? Why there is okay, stage 1, stage 2 and stage 3. I think you can, I know about this, all of you know about this. Stage 1 means what needed for normal, what needed for the baby, cervix should be dilated from uterus, starting of the uterine contraction up to full dilatation of the cervix. From starting of the what? From starting of the true uterine contraction up to full dilatation of the cervix, it is the first stage of labor. Usually in the primary 1 centimeter per hour, and multiple it is less. So there is a term latent phase of labor. এই তুমি ফলো করতেছো? বই দেখতেছো কি এখন বই দেখে তো পারবে না। So you should listen, okay? So there is first stage of labor. We divide the latent phase of labor. Another is active phase of labor. So latent phase of labor, that is contraction starts, but up to 4 centimeter, 3 to 4 centimeter dilatation, it takes a long time. That is not actually labor. That is called latent phase of the labor. And from after 4 centimeter up to full dilatation, that is called active phase of labor. It not causes 12 hours. It should be within 8 to 12 hours. Better within 8 hours maximum. We can allow her 12 hours. But you tell the actual hour what is written in the textbook. Maybe they written 8 hours or 10 hours like this. But you can tell 8 to 12 hours is the active phase of labor. In multi, it is in the primary, and multi?
6 hours.
Yeah, 6 to 8 hours, 6 hours. So this is the duration of the first stage of labor. So how much patient should be patience, na? How much she can need to tolerate, how much doctors, the midwives, doctors or caregivers should be patients. And always patient needs support, psychological support, counseling, food, and frequent movement, exercise, some exercise. She give always continuous assurance. But nowadays the patient becomes now changing. Why there is changing? No time? No time for delivery.
Pain tolerate
পেন টলারেট করতে চায় না, তাহলে পেন কিলার দিব। So there is a role of analgesic. So labor analgesic, that is called labor analgesic. ও বলতেছে যে পেন টলারেট করতে পারে না, so there is a role of analgesia. There is, of course, there is a role of analgesic. How can we give? How can we reduce the pain intensity? We cannot remove the pain, but we can reduce the pain. How can we reduce? It is indicated. How can we smooth muscle contraction? How can we prevent? Antispasmodic. How others? What are the others drug? Sedative. You can give sedative like pethidine, morphine, or say diazepam like this. And what are the paracetamol also sometimes reduce the pain. And what are the other drugs? Antox, there is a preparation of the oxygen and nitrous oxide, 50-50%. Inhalation of the antox gas, 50% oxygen and 50% nitrous oxide. When this increase pain severity patient, it inhalation from this, and then the patient goes to drowsy, when he becomes drowsy. Okay, so fetal monitoring is important. What are the other way? Now the latest. কি করতেছো তোমরা? What I am talking? What I am telling? দাঁড়াও তুমি, stand up. What I am telling? না আমি what I am telling. কি পড়াচ্ছি তোমাদের? Labor analgesia. Labor analgesia. Okay. So there is a role of epidural anesthesia. I think you heard the epidural. Nowadays, normal delivery encouraged by the epidural anesthesia. So when true pain starts, then give epidural anesthesia. You know all of you what is epidural anesthesia. And patient become like this, lying down or walking, take food like this, and but no more pain. That is, but the labor becomes slightly prolonged due to less dilatation by the epidural anesthesia. So there is labor analgesia. Okay. Then what is? So this is the first stage of labor. And what is the second stage of labor? Yes, also you know. So after full dilatation of the cervix, after delivery of the fetus, after delivery fetus is called baby. Until delivery the fetus, and after delivery the fetus become baby. When the vital sign and baby cry, whatever, after delivery of the fetus, it is called baby. Okay. So delivery is the that is after full dilatation up to delivery of the fetus, that is second stage. The third stage, after delivery of the fetus until delivery of the placenta, that is called third stage of the labor. So second stage, how many duration? কম না বেশি? কম. Already all things ready. But in the second stage of delivery labor, that is, it is divided into two parts. That is propulsive and expulsive. Propulsive and expulsive phase. That is when just still after dilatation, there is a time needed to baby to become crowning, and then when abdominal pressure added, that is called expulsive. When bearing down, you know the term bearing down. Bearing down, when the mother try to expel by the holding her breath and by abdominal wall pressure, that is called bearing down. When bearing down pressure added, then it is called expulsive. So there is propulsive and expulsive phase. So how many time the duration needed? Usually maximum primary there is maximum 2 hours, and multi there is 30 minutes maybe. So this is the duration. Duration is so important. If more duration, then fetus become distressed. Mother become exhausted. Fetus become distressed. So we should monitor carefully. It is like an intensive care unit. You know, the labor unit should be like an intensive care unit. Anytime any mishappen. What is mishappen? To the mother? Mother কি হতে পারে? Mother at any time can go to shock for different reason, even for pain also, and so many different causes. And that is another chapter, that is obstetric shock. We will discuss later. And fetal become suddenly cord prolapse or some placental insufficiency, or from any reason fetus become more distressed and ultimately become also stillbirth. When during the process of labor, if fetus die, that is called stillbirth, and without labor pain, if baby die, that is called intrauterine death. So during the process of labor, stillbirth. Okay. So this is so we should monitor carefully during labor, maintaining the partograph. Another heart, that is after delivery, then placenta. So we should give some time to the mother. Pain will be same or some reduce? Of course reduce. The large part is done. So pain so you should give to the mother to relieve some time for the separation of the placenta. From where it should be separated? Placenta from where? From uterine wall. Is it not? From uterine wall, placenta should be separated. How can you imagine that? How many times may be needed to separate? There is not more. 5 minutes, 10 minutes, but not more than 30 minutes. If it is more than 30 minutes, that is called retained placenta. That is called retained placenta. Then another maneuver needed to remove the placenta. So third stage of labor. Last day I saw a video. You saw that one. Okay, so I will give in the group. Okay, later I cannot open today the pen drive. I don't know why. Anyway, so the delivery of the placenta is in the third stage. And there is another term, that is first. After that, there is some period. It is also called the fourth phase for the mother, to observation, monitoring. Anyway, labor is only 3 components: first stage, second stage, and third stage. Okay, so and then what do you need? Management. Take some rest, management, before starting. So we have so many limited times. So we need to. You imagine everyone notice the labor. Who saw the labor, normal delivery? You saw? Very good. Anyone? Very good. So they have experienced how much tolerate the pain, what is needed. So there is for 3 stages, different management. First stage of labor need long management, responsibility. Second stage different. Third stage is different. So I think next class management we should discuss. Okay? Thanks.